The state is projecting unless more people start getting those booster shots, 2,200 people could be hospitalized with COVID by the end of the year. That would be the most we have seen in Colorado since the pandemic began. We have two reports on this crisis tonight. Jeff Todd looking at the obstacles to ending the pandemic. Want to start, though, with Karen Morfitt on our state's hospitals. Karen, they say they need more space for COVID patients who are recovering, and that's what we did see at the convention center early on in the outbreak.
Yeah, Jim, all of those extra beds here at the convention center, they're gone now. They were set up for this exact scenario, but they were never needed. Now that capacity is in question, the state is turning their focus to long-term care facilities already in operation and hoping that they can overcome one hurdle, which is staffing. While Colorado health officials are taking every step to avoid reaching hospital capacity, they're also planning for when we do.
It's not going to be the same when we built thousands of beds and they were standalone facilities.
Instead of seeing makeshift hospitals like we did when the pandemic began, long-term care facilities already in operation will be a focus for patients in recovery.
We've identified several that have capacity, either a wing they can't operate or a floor they can't operate.
Help that is needed now. In a statement, UC Health says, quote, "We have a large number of patients who are healthy enough to be discharged to a long-term care facility. It has been difficult to transfer some of those patients as some of the long-term care facilities and nursing homes may not be able to take additional patients." Doug Farmer with the Colorado Healthcare Association says their providers want to help, but they're facing some of the same challenges.
Staff, 100% staff. We just simply don't have the workforce. We don't have the personnel to provide care.
He says they're working with the state now on who could be called on to man those extra beds and how to pay for them.
Using traveling nurses from other states, also potentially leaning on some federal government resources.
Under the governor's direction, they now have 30 to 45 days to figure it out before we reach our predicted peak. Now, Farmer says that they have roughly 6,000 beds available in nursing homes alone. Now, we should be clear that patients who would be eligible for that type of transfer into these long-term care facilities would start with older patients where it makes sense to send them into these types of facilities. Farmer says they're going to be meeting with the state tomorrow and will be discussing how to make that staffing shortage less of a problem. In Denver tonight, Karen Morfitt covering Colorado First.